Okay, so imagine this. You're finally opening up to someone about something you've never told a soul. You're vulnerable, trusting them with like incredibly personal information. Now imagine that trust is just shattered because that information wasn't properly protected.
And unfortunately, in the world of behavioral health, where we're dealing with some of the most sensitive data imaginable, this scenario isn't just hypothetical. It's a risk we have to take seriously.
It really is. And that's where our deep dive takes us today. We're diving into an article from Xpio Health that stresses just how crucial continuous monitoring is to keep,
Absolutely.
behavioral health data secure.
It's so important.
And they argue that the old ways of doing things just aren't cutting it anymore. So what makes behavioral health data especially vulnerable?
Well, think about the kind of information we're talking about. Mental health diagnoses, therapy notes, substance use history. This is deeply personal stuff. And if this information falls into the wrong hands, it's not just a matter of financial risk, like a stolen credit card.
Exactly. It can have serious implications for someone's career, their relationships, their sense of self even.
Absolutely. And the article highlights that this vulnerability, it goes both ways. Not only are patients at risk, but healthcare providers are too. The reputational damage from a data breach, it can be devastating to a practice.
So let's talk solutions. The article keeps mentioning this idea of continuous monitoring. Break it down for me. What does that actually look like in practice?
Imagine you have a security guard. They're constantly patrolling, checking for anything suspicious, 24/7. That's essentially what continuous monitoring does for your data.
They're saying AI is a total game changer when it comes to behavioral health data security. Is this just hype, or is AI really that powerful?
AI brings a whole new level of sophistication to data security. Imagine trying to sift through mountains of log files, looking for that one needle in the haystack that signals a breach. It's tedious and, frankly, impossible for humans to do effectively. AI can analyze vast amounts of data in real time, detecting patterns and anomalies that would be invisible to us.
Feels like every time we talk about health data, HIPAA comes up.
HIPAA, for all its complexity, boils down to accountability. It's about knowing who accessed what data, when, and why, and guess what excels at keeping meticulous records? You got AI monitoring systems. They essentially create a digital trail of every interaction with sensitive data.
So it's like having a super-powered security camera that not only records everything, but also analyzes it in real time and alerts you to anything even remotely suspicious.
That's a great way to put it. Imagine being audited and being able to instantly provide proof of your data security practices.
That would certainly take some of the stress out of the situation. And don't forget about the human element. The article really emphasized the importance of training staff on cybersecurity best practices.
Absolutely. Even with the most sophisticated AI systems in place, human error can still be a major vulnerability. That's why regular training, phishing simulations, clear communication about security protocols are so essential. You need everyone on board, from the front desk staff to the clinicians, understanding the importance of data security and their role in maintaining it.
So it's a team effort. It takes a combination of smart technology, robust policies, and a well-trained team to truly protect behavioral health data.
Precisely. And the article did mention that Xpio Health, the company behind the article, actually uses a specific AI-powered solution. It's called Vanta.
Interesting. So they're putting their money where their mouth is, so to speak. Which, I mean, it makes sense. If anyone's going to understand the nuances and complexities of this issue, it's going to be a company that's deeply embedded in the behavioral health space.
Exactly. They understand the unique challenges and the incredibly high stakes involved in protecting this type of data.
So to wrap things up, it seems like continuous monitoring, especially with AI, is becoming essential in the world of behavioral health data security. But it's not a replacement for strong policies, robust encryption, or a well-trained team.
Well said. It's about taking a multi-layered, holistic approach to data security. And I think the most important takeaway here is that this isn't just about technology, it's about people. It's about protecting the trust that patients place in their providers and ensuring that the incredibly personal information they share remains secure.
Beautifully put. And on that note, we'll leave you with this thought. As AI plays an increasingly prominent role in healthcare, what steps can we take to ensure that this technology is always used ethically and responsibly, with patient privacy and well-being at the forefront? This has been a fascinating deep dive into the world of behavioral health data security. Thanks for joining us.